presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome this evening. I'm Lorena Anderson, your life and energy coach, and also your host for this evening. I'd like to thank All County Healthcare for proudly sponsoring You and Your Doctor, living a longer and healthier life, where patients are the heart of their business. And I'd just like to say that for All County Healthcare, patients is part of their business. They come together with such care, compassion, and the ability of listening and really taking time, patience, with all of their patients. So I'd like to thank All County Healthcare for proudly sponsoring this evening's show. And every Tuesday night, you can find us between the hours of 6 and 7 on 1470 AM, or we stream live on allcountyhealthcare.com. And also, we are on wwnnradio.com, where we are also streaming live. And I'd also like to say a special welcome to our Facebook friends that are out there on All County Healthcare. If you have any questions whatsoever, please call 888-717-7170. Ask for Maddie. She would love to answer any of your questions that you might have for All County Healthcare. In the interim, if you have any questions for our guest this evening, please give us a call at 888-565-1470. 1470. We would love to hear from you because our whole show happens to be about informing you, educating you, being able to give you the information that is so critical in your healthcare needs, what you might need to know, how to maneuver through the maze, whether it's your insurance or the proper type of doctor that you need to see. And I'd like to, put a plug into all of our doctors, all of our professionals. They're highly qualified. They are experts in their field. And every single one of them have such a warm and compassionate bedside manner. And I know that that's really what makes them so special. So, again, this is being produced by AMP2 TV and also proudly sponsored by All County Healthcare. So I would love to tell you all about our guest this evening. Her name is Dr. Hope Starkman, and she comes to us from MCA Medical Centers Affiliates. And she is a rheumatologist. So I'd like to welcome you this evening. It's great to have you here.
Thank you. Nice to be here.
Great. Tell us a little bit about you.
Okay, well, I am a board-certified rheumatologist. I have a couple of different practices. One of them for the last 3 years, a little more than 3 years, is with Medical Center Affiliates. Mm-hmm. I am their in-house rheumatologist. We have two. Okay. And I have another private practice in Boynton Beach, very close. And I see adults with all kinds of arthritis-related conditions in the Boynton, Delray, Boca, West Palm Beach area. They come from everywhere.
Wow. So you've got the two offices, one in Delray. Where's that located?
The one is on Atlantic Avenue, right near Kings Point. It's west of Jog Road.
Okay, excellent. And your other office is in?
Is in near the Renaissance Commons in Boynton Beach on Congress and Gateway.
Beautiful. And how long have you been practicing?
Down in Florida for about 24 years. I moved from New York.
Oh, did you?
Fresh out of training.
Oh, great. Oh, that's wonderful. What inspired you to go into this field?
Well, I really like outpatient medicine for the most part. I did a little bit of everything. I worked in emergency rooms. I worked in walk-in clinics. I worked as a hospitalist. We called it a house doctor before it became a hospitalist. So I did a little bit of everything, and I really like relationship building with patients, and rheumatology enables you to have a relationship with patients because they come frequently for medical problems that are chronic, although we see some that come once in a while. Most of them are ongoing patients. I like the relationship.
I see. Oh, well, that's nice to know. And from what I understand, you spend a lot of time with them, being able to listen to them, being able to connect with them. What makes you extra special? I mean, I know those two do, but what else makes you special?
Well, I think especially for rheumatology, the history taking, the history of other medical problems that the patients have, their medications, the whole package is really an important part of rheumatology. So a lot of time has to be spent sitting down with the patients and speaking with them, of course, examining them. But the history is so important because we use a lot of medications that can do a lot of things good and bad. And we need to know, and each patient is really like like their own piece of art, very different from one to another. You can have 3 patients with rheumatoid arthritis, but each one is very different. So you have to tailor your treatment like art to each patient. So I think that's what makes rheumatology especially interesting nowadays because we have so many new medications and more in development. And we have to look at that whole patient individually and make our choices.
You know something, that's absolutely beautiful. I've never heard of a doctor classifying their patients as a work of art.
They're all a work of art. Doctors are
I
too.
totally agree. I totally agree. I think each one of them are special in their own way, but then, their needs, I love the fact that you customize your services to be able to meet their needs. But on another level, their needs are so generalized, because they need their time. They need to be able to explain what they're going through, how they're going through it. So, you're not only dealing with the mental piece of it, the physical piece of it, but you're dealing with the emotional piece of it as well.
Yes, that's very true.
Yeah.
And then you're dealing with all this in a climate that is challenging for patients with respect to insurances, limited medical formularies, needing referrals. There's a lot of little pieces that have to go into that puzzle when you're making a decision for treatment of each patient individually.
You mentioned something just now that was very interesting. I don't think I've heard of it before. Formularies. Can you expound on that for us?
Well, let's go backwards a little bit. Let's talk about, this has become an interest of mine over the last several years. I do many peer reviews every month looking at medical necessity for patient care with respect to medication, lab tests, x-rays. So let's go back to the beginning of this. So when a patient chooses a healthcare plan, it's probably one of the most important decisions that they make.
Very
They must
true.
look
Yes.
at a plan that works for them. We were speaking about different plans, Medicare and supplements or managed care Medicare before I came into the room. And each patient needs to look at what their needs are because every plan is going to offer a different contract. Having a plan is basically a contract with your insurance company. And not every contract covers everything. Every medication, every lab test. There's preferences, there's formularies for medications, which may limit your medication choices. And the medication choices that your doctor has for you is limited to, unfortunately, or sometimes fortunately, by these formularies that your insurance plan has for medications.
That's really interesting. So you must have to go through a lot of research to make sure that whatever drug you prescribe is covered by their insurance.
Yes. Well, frequently there's a procedure called step therapy. Step therapy means that before you can get drug C, you have to go through drug A and B. So that's where the history taking is very important. For rheumatoid arthritis, the first step is often a medicine called a disease-modifying anti-rheumatic drug, a DMARD. And in that category would be a drug like methotrexate or Imuran or even Plaquenil, sulfasalazine. So those drugs must be tried for most health insurance plans to get to the next level of the formulary, which may be a more advanced and very expensive drug like a tumor necrosis factor or another type of what we call biologic drugs. So you must go through the steps of the insurance plan, which does not have it's not randomly decided. All these decisions are really based on literature, on studies looking at patients and different patient populations. So it's not random. It is definitely taken into account is costs of drugs as well.
Right. Exactly. So what the patient has to go through first is they have to go through the first layer, say the A's.
Yes.
And what happens if they don't quite work? I mean, then they have to be transferred then to the B level and then to the C level?
Well, very commonly the A level and maybe even the A and B level or combinations of A's or A's and B's, like, for example, Plaquenil plus methotrexate plus sulfasalazine, 3 different DMARDs, which is an appropriate therapy for some patients. It doesn't work. So we have to go to the next level, which might be the addition of a biologic drug. Usually the biologic drug is a TNF drug like Humira, Enbrel, Remicade. But again, not every insurance plan covers each one of those or every biologic drug. So if you're a patient that, say, has taken methotrexate before for rheumatoid arthritis, and you've taken Enbrel as well, and you didn't respond to that, you need to look when you're choosing your healthcare plan at the formulary for the plans that you're looking at to make sure that other drugs that you might be prescribed are on that formulary. It's really important because it's better to know before you get there than once you're there, and then you have to go through all kind of appeals.
Wow. It sounds like such a maze. Please, if you have any questions for Dr. Starkman, please give us a call at 888-565-1470. And we're here to answer any of your questions. I mean, some of these drugs that you're talking about, I couldn't even pronounce if I tried. Oh, my goodness. So, and I can only imagine what it is for our senior population as well, and how difficult it probably is to try to navigate through that maze. And so please give us a call if you've got any questions and you want to ask the doctor. So does that hinder their ability of reducing the pain? I know that there's no cure for this. Am I correct in that?
Well, do you mean that do the drugs hinder the ability, or does the process hinder the
process?
Well, the process can, because it can be a lengthy process. For example, you have different levels of appeals. If you're a patient that's on Humira and you're a rheumatologist, should be a rheumatologist if you're dealing with rheumatoid arthritis or a rheumatologic condition, wants you to be on one of the newer drugs like Zildjian, which is a new great oral drug for the treatment of rheumatoid arthritis. A lot of the times, if that drug is not formulary, you may have to go through 2 or 3 tumor necrosis factor inhibitors. So that could take time. It could take time for you to get from point A to point D. Hopefully, along the line, you are getting some benefit and relief of your symptoms, because it really would be inhumane to have someone go through months and months and months of non-treatment to get to a point where they can actually prove that they need something. But I have to say, that can happen. So it's very, very important to have a good relationship with your rheumatologist, to ask questions, to see where you're going, to map out a path for your care, to discuss if A doesn't work or B doesn't work, what's the next step, so that you can plan. And also to have a physician that is willing to take the time to go through those steps with you. I think we're very fortunate being in South Florida. Our rheumatologists, and I know all the local rheumatologists, are excellent, very well trained. They know the newest drugs, but it's up to you too as a patient to understand the process and the new drugs as well. But I think we're really fortunate down here in Florida.
Well, that's very good. So, if they want to get a hold of you, how can they do that?
Well, my office is on Atlantic Avenue, and I'm with Medical Center affiliates, which again is a little bit west of Jog Road, past Kings Point. I'm there 2 days a week. I'm also in Boynton Beach at Ocean Ridge Arthritis Associates 3 days a week. And I'm pretty easy to find. I'm Dr. Hope Starkman, and I have a website online, and Medical Center Affiliates has a web center online as well. So very easy to find me.
Great. Excellent. Excellent. Well, you bring up a lot of interesting concerns that somebody who's dealing with arthritis can face. I mean, as you were talking, I was getting the idea also that they find an insurance coverage and it takes care of this drug A and then level B, but they haven't really quite gotten the relief that they're looking for. And, drug C, they don't even know about yet. So it's kind of, it's a gray area, especially if you're trying to find an insurance company that's going to cover that drug.
I think it's really important to sit down with your doctor and map out where you're going, where you are now, where you might be a year from now, what happens if this doesn't work.
Good.
What other treatments are out there for me? What other treatments are being developed? This year we have some new drugs called biosimilars, which are biosimilar to some of the tumor necrosis factor drugs like Remicade, which should be, we're figuring about 30% less cost, which should make it more accessible to patients on some of the managed care plans that had a struggle, before getting these medications. Due to now, one managed care plan may cover Enbrel, Humira preferred. One may cover Cimzia, Enbrel preferred. It's whatever they have. It's probably based on whatever they've worked out with the manufacturer of the drugs. It doesn't mean one's better than the other, one's worse than the other. It's what is better for you, the patient. Because one patient may respond to the first anti-TNF Enbrel, and one may go through 3 of them and then have to go to a drug with a different mechanism of action. So really important to keep an open mind and to have an open discussion with your doctor and map out a plan for care for your chronic treatment. Not only rheumatoid arthritis, it's true of osteoporosis, lupus, any chronic conditions that are not arthritic or immunologic as well.
So I'd just like to take this time out and audience listeners, please write down the various medications that you've been taking and have that discussion with your doctor so that they know whether or not this particular drug is working for you or or if they need to make a combination of drugs for you. And then, as the Dr. Starkman had mentioned, find out what the plan is then for continued care. What happens if this stops working? Now, do you find that happens every now and then, where all of a sudden the drug's working, and then it stops working, and then what?
Yes, that happens very frequently. Some of the reasons for that is some of these drugs are proteins, and as you take them over time, your body may develop antibodies or resistance to the drug. So some drugs require dose escalation over time. Some require a complete change. Some require, say a patient had been on 2 anti-TNF drugs. There's a chance that, since they failed to respond to 2 drugs in the same class of drug, they may need a completely different class of drug. Maybe their arthritis is no longer responsive to that drug type.
Wow. Excellent. Well, I'd also like to take this moment to say thank you to All County Healthcare for sponsoring these shows, you and your doctor. They bring the highly qualified professionals that have expertise in their field. And our whole purpose here is to be able to help inform and educate you, because that's the utmost. We want to make sure that you are well taken care of, because as I said before, patients are the heart of All County Healthcare, part of their business, and that's really what drives them. So I thank you thank you, All County Healthcare. Thank you, Dr. Starkman. Let's continue with our conversation. What are some of the? Do you see an increase in a particular type of arthritis, or is it kind of across the board with the various different various arthritis diseases?
Well, there's many types of arthritis. When I speak to patients, I tell them that you can break arthritis into two main categories, though. You have the degenerative, like osteodegenerative arthritis, and the inflammatory arthritis, which most other conditions fall under, which would include rheumatoid arthritis, gout, psoriatic arthritis, ankylosing spondylitis. Those are the osteodegenerative are more generally biomechanical related. Higher weights contribute to it. Repetitive trauma contributes to it. Those are generally treated with analgesics, injections, anti-inflammatories. Whereas the other category, the inflammatory forms of arthritis like rheumatoid, you have to sit down with the patient. That's where the history taking is really important because, and the diagnostic testing, the lab tests, the rheumatoid factors, the SED rates, the genetics testing for ankylosing spondylitis, all very, very important to differentiate which type of arthritis you're treating, which type of arthritis you're dealing with, because different drugs are indicated for different conditions. So we need to know what we're treating. And, sometimes that could take months to establish the diagnosis because a lot of our disorders are criteria-based. And a patient may come in with 2 or 3 criteria for lupus, and, you have to have 4 criteria to really make that diagnosis. So over time, sometimes these diagnoses have to be established. When a patient walks into your office the first time, sometimes you just don't know. So very important to take that time.
Yes. Well, I commend you for taking that time with your patients because I know how critical it is and how necessary it is to be able to get that information. And not only that, you were talking about all these tests and everything. Do you find that the insurance companies cover those tests as well? Or are we dealing with the same thing with the drugs as we are with the tests?
Well, I think if the provider has a basis for doing their testing, like, for example, someone with back pain, seeing them for the first time, unless they have a chronic condition that they've already gone through an x-ray and maybe some physical therapy and some, first-level treatments, it wouldn't be appropriate for the patient to walk into your office and you order an MRI of that patient the first time because, hey, it's expensive and it's not necessary. Most back pain goes away after a month or 2 months or 3 months. 80-90% is gone. It's after that time when you start, saying, hey, maybe I need to get some more tests. Maybe the patient has spinal stenosis. You can't see it on an x-ray. Maybe the patient needs an epidural, which I don't do as a rheumatologist, but I would refer it. And I wouldn't refer a patient for an epidural without an MRI or CAT scan, say if they had a pacemaker and couldn't get an MRI. So as long as there's justification based on history, but also based on literature is very important. Science, when you see clinical studies being done, those are not, it's not that those studies are trying to make guinea pigs out of patients, it's that we need those studies to be able to prove treatments and tests change the outcome of an illness. So those are very important things. So I don't think testing is covered when it's just randomly done. I think there has to be reasons to do every test that you do. And as long as you have that, as long as the physician has that and can justify it, and sometimes it means appealing a no decision, a negative decision. But if there's good enough reason, I think those tests are generally always covered. And appeals run several levels. Level 1, is maybe based on the policy alone, your contract with your insurance company. Level 2, appeal may be based on a review by a peer, so rheumatology reviewed by a rheumatologist. And it can go up, in the level of appeal so that you can get to a federal level appeal if there's something that the patient really, really needs and the insurance company is not covering it. And at that point in time, we look at the literature very heavily. It weighs very heavily.
I see. So you had mentioned before that you do peer reviews. Can you give us a little insight as to what that's all about?
Well, that came about by accident with me. Someone found me on on LinkedIn actually and asked me if I wanted to do peer reviews, and I thought it was a joke. And now it's just something I love doing. I love it. It's like being involved in a story and you're reading the story from the outside, so you can see a lot sometimes that people on the inside are not looking at because they're so close. But I do reviews for medical necessity.
Okay.
Say, we talked about, say, a patient has rheumatoid arthritis, but they have another inflammatory condition as well, maybe Crohn's disease. So the provider is trying to get a drug that may be approved for both conditions, but the insurance company, one of those conditions, the drug that the doctor is choosing is not formulary. So I would be someone, or someone who does these peer reviews would be someone who looks at the whole picture, says, okay, well, this drug and this drug are only approved for rheumatoid arthritis, but this drug is approved only for ulcerative colitis, or maybe it's Crohn's. But here's a drug that's approved for both. So why can't this patient get that drug? And if you can get the literature, review the literature and find support for it, then you, as a peer reviewer, you can probably get a denial overturned.
Wow.
It's very important to look at the patient, the history, their past history, where they've gone, contraindications. Do they have other medical problems that conflict with the treatment that is approved by the insurance plan? And can you bypass the preferred drug formulary based on literature? So that's what a peer review would look at. A peer reviewer would look at.
That is wonderful. That is, well, you're invaluable.
Thank you.
You're totally invaluable and absolutely necessary, because you're right. You know, at least from what I've heard, a lot of these insurance companies, they don't have the same type of qualified individuals on the other side, either, you know, denying the claim or allowing the claim to be paid. So it's absolutely essential to have yourself a peer review for medical necessity, be there to be an advocate for those patients. So thank you very much.
Thank you.
It's been an absolute pleasure having you on the show tonight, you and your doctor. And please tell the audience again how to be able to get a hold of you.
Again, I practice at Medical Center Affiliates in Delray Beach. We actually have 10 offices. I go to the Boca Raton office as well, which is on Palmetto Park Road. And then several days a week, I'm in Boynton Beach at Ocean Ridge Arthritis Associates. You can Google me, Dr. Hope Starkman. I come way up there. Place, so,
excellent.
Yes,
excellent.
it takes work to get to that.
Yeah,
So.
well, and it takes great reviews as well, from what I understand, and great recommendations.
Thank you.
It has been a great pleasure. Thank you so much
Thank
for
you so
coming
much.
on the show. And we're going to break for a commercial at this moment. Do not go away. We've got another great guest who's going to also inform and educate you, and it's going to be on Medicare, the insurances. Okay? We'll see you right back. Stay tuned.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson. I'm your host for this evening, You and Your Doctor, living a longer and healthier life, and also a life and energy coach. So we have another fabulous guest who has come on to help inform and educate us, especially when it comes to the insurance complications and ramifications that we might run into in trying to make those decisions and those choices. Now, the one thing that you heard from our last guest, Dr. Starkman, was the complications that we might run into in finding the right insurance company to cover our prescription needs. So we decided, thank you, All County Healthcare, for providing the show, but also for providing these highly qualified professionals to come and educate us as well. So tonight we have Andreas. Hello, Andreas.
Hello. Good evening, everyone.
Yeah. And he's with Medicare Market Advisors. So I'd like to welcome you. It's great to have you here. Give us a little bit of your background.
Well, insurance. Medicare insurance. I think we're in the right state for it.
Yeah, I think so. Yes, absolutely. Where's your office located? Telephone number?
We have offices in Gainesville, Florida, Orlando, Florida, and Fort Lauderdale, Florida.
Oh, okay. All right. Fort Lauderdale, my little area there. That's where I live.
Beautiful Broward.
Yes, it is. And I also lived in Orlando as well. So excellent. You've hit all those very important places, huh?
Yes, the fun spots.
The fun spots. Yes, absolutely. So how long have you been in the business?
I would say going on 24 years now.
Directly out of what?
College. University of Florida.
Oh, okay, great. Mm-hmm. And what made you decide to take this as a passion?
I didn't decide. It's one of those things that you fall into. My background is in finance, and I was in the finance department at Humana Healthcare. And from there, it was just a natural fit.
Wow. Okay. Well, I was going to say, usually we don't fall into too much. I mean, we're kind of like guided, I think, or our path opens up, and then we decide whether or not we want to take that path or another path, or so. But a lot of times, people are drawn to it because they really care about what they're doing. Not only that, they care about the patients as well.
Well, that's kind of what happened to me in the sense that when I was introduced to this business, it was the actual ability to help someone that doesn't know exactly where to get the answers. And so guiding them, it became your
passion.
A passion, if you will.
Yeah. Absolutely.
It was very rewarding.
Oh, that's great. I bet it is. Yeah, you must have gone through so many various changes, from when you first entered the business until today. Can you share some of those changes that you've seen?
Well, Medicare has changed dramatically. The business has changed dramatically. Our population is aging. There's more demand for senior products. It gets more complicated. So we're here to provide solutions to basically help people understand their options so they can make an informed decision.
What do you see as some of the real finite? It's almost like a labyrinth of choices. I mean, sometimes I can only imagine. When you're 65, although 65 isn't old anymore, right. But still trying to make those choices. What's going to provide the best coverage for them? It must be awful difficult.
Well, it's a varied population. I mean, one of the biggest misconceptions is that to be on Medicare, you're 65 or older. True, it is one of the largest groups in Medicare, but you have a lot of folks on disability. Mm-hmm. You have veterans that are coming out of the war that are getting Medicare. So it's a varied population, and now the companies have stepped up and offer plans to meet different needs. Mm-hmm. And I think that's really important. And it kind of complicates things because it's no longer one plan, one company. It's multiple choices. And that's where we can help figure that out and guide them in the right choice for them.
Wow. Yeah, because I know just myself, trying to figure out, okay, first of all,
Your open enrollment.
yeah. I mean, it's kind of like you cannot move your insurance company or your benefits at all for a whole entire year. So, you're pretty much stuck. And if you haven't made a good choice in being able to find out what exact coverage you do need, what do you do?
Well, yeah. You call us.
Yeah,
We can
okay.
help you.
And where do we reach you at?
You can call us at locally 305-510-2216.
Slower now. Tell us a little slower, just in case, because audience, I really do want you to be able to write this down. Okay. And also our Facebook friends, it's wonderful to have you here as we're streaming live with you. If you have any questions, by the way, for All County Healthcare, because they can help you as well, give them a call, 888-717-7170. Ask for Maddie. She would love to answer any questions that you might have. And give them your telephone number again so they can call you.
305-510-2216.
Okay, great. Do you have a website as well?
We do.
Okay.
MedicareMarketAdvisors.com.
Okay, great. Excellent. Well, it's so important now to be able to identify what your needs might be. Tell us a little bit more about the various plans, what they cover or the costs. I mean, I'm kind of under the assumption that Medicare, straight Medicare, is the way to go with a supplementary insurance company to pick up the deductible.
The gaps, right?
Yeah.
Well, it varies on the person's needs, really, and you have choices with Medicare, and someone on Medicare has three basic choices. You can have Medicare by itself, which is not very wise because it doesn't cover everything. So you have two other choices to become fully covered. You can buy a Medicare supplement, or you can look at some of the various types of Medicare Advantage plans. They have HMOs, and PPOs seem to be the most popular.
Okay. Well, that's really interesting. Because I've always kind of heard that the Medicare, straight Medicare, it really does cover a lot. And sometimes with the HMOs, you have to wait for referrals. You have to. A lot of times the specialist might not be covered. Talk to us about that.
Okay. I guess the best way to look at it, it's two systems. Medicare is a curative system. So it's basically one of those systems that if you are sick, if you are hurt, it will cover you. Medicare Advantage or the Medicare Advantage option, you have different plan types, but they're all based on prevention. So let's look at things before they happen so we can catch them in the early stages. In addition to that, you have the difference in coverage. The Medicare Advantage plans are comprehensive. They include your Part D, which is your prescription drug coverage, but they also include a lot of things that Medicare and your Medicare supplements do not cover, such as the vision, the dental, the gym memberships, worldwide coverage, over-the-counter products. You know, they give you an allotment. Some actually rebate you part of the Part B premium. So it's really a matter of what fits that individual and their individual needs, and that's what we do.
Oh, okay. Wow, that's really interesting.
It can be.
Yeah, I'm going to say, whoo.
Well, if you're turning 65 and you don't know your options, it's something that is top of mind.
Yeah, absolutely. And especially, that can be so critical at that point because you have to live with it for a whole year. And,
That's not actually true, but for
unless
simplicity,
aren't there some...
There is an enrollment period.
Okay,
But there's
when is
many
that?
reasons why or when you can change just depending on your circumstance. For example, there is an open enrollment. It's called the annual election period. That begins very soon. It starts October 1 and goes through December 7th.
Okay.
And then agent-assisted enrollments and sales occur beginning October 15th through December 7th. That's for the majority of the folks. But you have folks with special needs and special conditions that allow changes throughout the year. For example, people that have Medicare and Medicaid or a low-income subsidy or plans that offer chronic condition plans, special need plans, can make changes. So if you have COPD or cardiovascular issues or diabetes, there's some companies that offer special needs plans for those chronic conditions, allowing folks to change and make changes throughout the year,
Really?
not just during the annual enrollment period.
Wow. Well, that's really interesting because I've not heard that one before, but that's very, very interesting. What other things can allow you to change insurance plans during the year?
Basically, it's any special circumstance, whether you move from one county to another, out of state, whether you have retired and now want to activate your Medicare. If you meet one of those conditions, if you become eligible for a state or a federal program, such as low-income subsidy, which helps with the prescription drugs, or if you're dual eligible and qualify for Medicaid or any level of Medicaid, you also have the opportunity to make changes throughout the year. You're not locked in.
Okay. Very, very informative. Yes. Well, and that's important too, because, especially with Medicaid, sometimes, you do run into situations where all of a sudden your income is cut or it's lowered or a number of variables.
Well, it's interesting you mentioned that because people think of Medicaid as, you're really down and out. But there are different levels of Medicaid, and it can happen to anyone. As you just mentioned, if you lost a loved one or if you know of someone that lost a loved one, the income changes, and that impacts many people.
Yes, exactly. Or if they really do have a very difficult disease, a life-threatening disease,
Sure.
and it can suck up your savings as well, trying to pay for that.
And that's where a lot of these Medicare Advantage plans and companies offer, number one, it's if you live in their service area where they're offering benefits. And if you have both parts of Medicare, they do not look at your health. As long as you do not have end-stage renal disease, people on Medicare, regardless of their situation, are eligible to look at these plans annually at the very least.
Wow. Well, that's really good to know as well, because sometimes you feel as if you're stuck. We were just talking with Dr. Starkman.
I heard.
And she was talking about the various prescriptions as well, and whether or not they're covered by the Medicare Part D, and whether or not that the formulated prescriptions are within the range of coverage. So can you expound on that a little bit for us, please?
Well, your Part D has a standard plan offered by Medicare, and it's known as credible coverage. Okay. And that coverage has a standard where they're basically making sure that all the prescriptions that are needed physiologically in any health condition are available. And so they have at least 2 classes of medications for every condition. And that sets a template and a standard, and all companies that want to offer a Part D plan have to at least meet that standard.
Oh, okay.
So you may not have your particular brand of medication available, but that class and for that particular condition, you will find the drug that covers that. And I think Medicare and CMS has done a great job with that.
Wow. Okay, that's really interesting. That is very interesting. I'd just like to take this time out to say thank you, All County Healthcare, for proudly sponsoring this show for us. Every Tuesday, we're here from 6 to 7. If you have any questions whatsoever for our guests this evening, please give us a call at 888-565-1470. Any questions that you might have about Medicare, about Medicaid, coverage, the various plans that are available, just please give us a call. We would love to answer any questions. On the other hand, for our Facebook friends, welcome. It's great to have you here. And if you have any questions for All County Healthcare, by the way, you can find us on Facebook at All County Healthcare. If you have any questions for All County Healthcare, please give us a call at 888-717-7170. Ask for Maddie. She would love to answer any questions that you might have concerning your healthcare needs. So, back to insurance. Give us a little bit. You said that What happens if a doctor doesn't participate in one of your specific doctor doesn't participate in one of the plans that you have chosen?
It's somewhat unusual, but it does happen often. And you have choices. The doctor can participate and apply to be a participating provider in any number of companies. We often, our agents sometimes run into that situation. We reach out to the practice. It turns out that the doctor's actually been looking for or wanting information or is in the process of getting contracted with a particular company or companies. So that's not an end-all, stop-all.
Okay.
So it just depends.
Okay. All righty. Give us a little bit more information about how many different plans there might be out there under. I know. God. I understand one of my dear friends, she's a plastic surgeon. So, we have these long discussions and everything about insurance and which one she's going to allow in and which one's covered. And it's quite a maze.
Well, it is, but like everything else, there's a solution, and I think Medicare does a good job of selecting these plans. You have a number of plans. Each company has multiple plans to fit an individual's needs. So they have programs for the active, they have case management programs and health management programs for the chronic illnesses. So depending on your situation, you would look at a number of companies, and we try to figure that out. Basically do a needs analysis, find out what are the major concerns that client or potential member has, and then from there offer a solution.
Excellent.
In order to know,
Yes.
you have to know your options.
Okay.
And most people, surprisingly, don't know their options. There's a big misconception with managed care that it's all HMO. Well, if you don't like the HMO, there's different plan types. You don't need referrals for every plan or every company. There are PPOs. There are private fee-for-service plans. There's open access plans. And this year, 2017, the plans are coming out with incredible benefits. You're going to hear more about the PPOs and the HMOs and how they're expanding their networks. And so feel free to call, and we'll help guide you.
Well, tell them your name, telephone number again, how to get a hold of you, please.
Folks, it's Medicare Market Advisors, MMA 65, and you can call us locally at 305-510-2216. In Gainesville, you can call us at 904-317-4700.
Excellent. And as for you, Andreas.
That's correct.
Yes, excellent. Excellent. So some of the other things that we want to talk about, the difference between a Humana versus an independent agent. Can you expound on that?
Between Humana and
yeah, it says, what are the differences as an insurance agent that works exclusively
I see.
for one of the insurance companies? Example, Humana versus an independent agent.
Okay. Well, I guess what is trying to be asked is, if I am a consumer and I'm trying to find out my options, and I'm looking at the various insurance companies. Insurance companies have agents, captive agents, that work exclusively for them, representing, say, for example, you mentioned Humana. If I'm a Humana captive agent, I represent Humana and only sell or promote or market Humana products.
Okay.
As a consumer, I may be looking at 3 or 4 different companies, so I would have to speak to 3 or 4 different agents. Well, when you look at the independent agent community, you have insurance professionals that represent many different companies and could probably sort things out a little bit quicker by sitting down with
quicker.
you
Are you
than
kidding?
going through, multiple appointments and so forth. So it
Yes.
just makes things a little bit easier. The information in whichever way you get it is very regulated, and it's very they go through a lot of training, so it's a regulated industry, and it's very difficult to become certified and to go through all those motions as an agent to be able to represent these companies. So
Wow.
it's not something where there's a massive difference in the information. It's just in the speed and the conciseness that you get it. As an independent, you would be able to analyze the situation that your client or prospect is in and break it down quicker without any biasness whatsoever based on their needs.
Yeah, because it really doesn't matter to you one way or the other.
As long as we can help that individual and guide them to provide them the enough information so that they can make an informed decision. That's our goal.
So one of the other things that I want to say, to our listeners here, that if and when you are looking at either changing your insurance company or you just want somebody to do an overview, Andre is the gentleman to go to, because he can sit down and he can take an overview. Make sure, though, that you bring your history. As we were speaking with Dr. Starkman earlier, your history is just absolutely incredibly valuable so that you know exactly, the plan that's going to fit for you the best. But so make sure that if you come and talk to Dr. Andre,
Well, I think I just got a promotion.
Yeah. And Dr. Insurance here. Give him a call and ask him the questions that are on your mind, that are concerning you. And they can sit down, they can answer. I've had a couple of very dear friends go through all of that testing and to be able to be certified in order to represent, 3 or 4 or 5 different companies. So it's tedious. I mean, your education is valuable.
But it's a good tedious.
It is a good
it's
tedious,
holding
yes.
the standards of the agents that are able to go through that
Loophole,
hurdle,
yes,
if you
absolutely.
will, to do a better job and be informed. And it's all to protect the Medicare beneficiary.
Yeah. Well, and something. So I commend you,
Thank you.
For
Well,
helping.
I'd like to add that
Yes,
everybody,
please.
regardless of your situation, I currently have a plan, I currently have a doctor, everyone should review their benefits annually. And that's the purpose of the annual enrollment period. You want to review your benefits every year. Your doctors typically participate in one or several plans at the same time. So ask them which plans they participate with.
Okay.
But everyone should do a review in AEP, which begins again October 1st through December 7th, is your opportunity to become informed, to find out what plans are out there. Is your plan offering you the best? Do you have the most coverage with your plan today?
Yes.
And if your doctor participates in other plans that offer you more, why would you not look at that? It behooves you.
Absolutely. And something, your health can change over the year. So you're absolutely right.
Overnight.
And overnight, yes, absolutely. So I'd like to thank you again for coming on our show, you and your doctor, living a longer and healthier life, and giving us this valuable information, because it is really critical to be able to find the particular healthcare plan that's going to give you the best benefits, the best bang for your buck,
Absolutely. I mean, that is really the mission. The big takeaway here is to know your options so you can make an informed decision.
Excellent. Well, I'd like to thank again All County Healthcare for providing this show, for sponsoring this show every Tuesday between the hours of 6 and 7. We have some of the most highly qualified professionals here. So please, join us. Give us a call. And if there are any doctors out there also that are interested in being on our show, please give us a call at 888-717-7170. We would love to hear from you, because our whole premise here is to help educate the listeners, our audience, in making those informed choices. So thank you again for being with us. I'm Lorena Anderson, your life and energy coach, and we'll see you next week, Tuesday. Bye for now.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.